Artificial Intel Pros and Cons, a career guide navigated by Brian Ross and ChatGPT 29 to 1181 audiologists. AI. Statement: AI can support audiologists by helping analyze hearing test results, organize patient records, adjust hearing technology, track treatment progress, and identify patterns in hearing or balance concerns. AI may assist with hearing aid programming, cochlear implant data, tinnitus support tools, telehealth, speech recognition systems, diagnostic equipment, and electronic health records. AI does not replace clinical judgment, patient counseling, hands-on testing, ethical responsibility, diagnosis, or professional treatment planning. This role may become more technology-supported as hearing healthcare uses advanced hearing devices, remote monitoring, digital testing, and AI-assisted sound processing. Pros: audiologists perform meaningful healthcare work that helps people improve hearing, communication, balance, independence, and quality of life. This role can offer stable healthcare demand, professional respect, specialized clinical expertise, and strong patient impact. The job builds transferable skills in diagnostics, patient care, technology, counseling, communication, documentation, and treatment planning. Experience can lead to advancement in clinical leadership, private practice, hearing aid services, cochlear implant programs, research, education, pediatric care, or geriatric care. Cons: the career requires advanced education, clinical training, licensing, and continuing education. Audiologists may work with patients who are frustrated, anxious, elderly, disabled, or experiencing communication challenges. The role requires patience, accuracy, and strong counseling skills because hearing loss can affect work, relationships, safety, and independence. Some work settings may involve insurance documentation, productivity expectations, sales-related hearing device discussions, or complex patient needs. Bottom line: audiologists are a strong fit for people who are healthcare-minded, patient, detail-oriented, and interested in hearing, communication, technology, and patient support. This is a strong healthcare career for someone who wants specialized clinical work, meaningful patient care, and long-term demand in hearing and balance services. Audiologists 29 to 1181. Career guide: a strong audiologist usually develops through graduate education, supervised clinical practice, licensing, diagnostic training, hearing technology experience, and patient counseling. Successful audiologists are compassionate, accurate, calm, professional, and able to explain hearing information clearly. Experience in healthcare, communication disorders, speech-language support, psychology, biology, customer service, assistive technology, or patient care can be helpful. SOC description: audiologists diagnose, manage, and treat hearing, balance, tinnitus, and related auditory disorders. They perform hearing tests, recommend treatment options, fit hearing aids, counsel patients, and help improve communication and quality of life. Common duties: evaluate hearing, balance, tinnitus, and auditory concerns. Perform hearing tests, screenings, and diagnostic assessments. Interpret test results and explain findings to patients. Fit, program, adjust, and troubleshoot hearing aids or assistive devices. Provide counseling for hearing loss, tinnitus, communication strategies, and device use. Work with physicians, speech-language pathologists, educators, families, and care teams. Maintain patient records, treatment plans, and clinical documentation. Recommend referrals, follow-up care, or specialized testing when needed. Support cochlear implant evaluations or hearing conservation programs. Educate patients on hearing protection, communication strategies, and device maintenance. Core skills: hearing assessment, patient care, clinical judgment, communication, counseling, hearing aid technology, diagnostic testing, treatment planning, documentation, problem solving, compassion, attention to detail. Qualifications: audiologists usually need a Doctor of Audiology degree or equivalent professional graduate education. State licensure is typically required. Employers may require clinical experience, supervised practice, certification, background checks, continuing education, and knowledge of diagnostic equipment and hearing technology. Experience with hearing aids, tinnitus care, cochlear implants, pediatrics, geriatrics, healthcare documentation, or patient counseling can improve opportunities. Characteristic traits: compassionate patient, detail-oriented, healthcare-minded, professional, clear communicator, ethical, analytical, calm, supportive, technology, comfortable, responsible. Resume template: your name, city, state, phone number, email address. Professional summary: patient-focused audiology professional with interest in hearing healthcare, diagnostic testing, hearing technology, tinnitus support, and communication improvement. Skilled in patient counseling, clinical documentation, hearing assessment, device support, and compassionate care. Core skills: audiology assessment, hearing testing, patient counseling, hearing aid support, tinnitus care support, clinical documentation, assistive listening technology, patient education, healthcare communication, diagnostic equipment, education, college or university name, Doctor of Audiology/Audiology degree, year relevant, bachelor's degree, clinical experience, clinical role or rotation name, clinic, hospital, school, or organization, city, state, dates performed or assisted with hearing evaluations, screenings, or diagnostic testing. Supported hearing aid fittings, adjustments, troubleshooting, or patient education. Documented patient information, treatment notes, and clinical findings accurately. Communicated with patients, families, supervisors, and healthcare teams. Followed clinical procedures, privacy rules, safety standards, and ethical guidelines. Licenses/certifications: state audiology license, CCCA, ABA certification, or other credential, CPR/BLS, if applicable. Additional experience: healthcare, speech-language support, patient care, customer service, assistive technology, education, research, or communication disorders experience may be listed here. Cover letter template: dear hiring manager, I am applying for the audiologist position. I am interested in this role because it combines healthcare, communication, diagnostic testing, technology, and meaningful patient support. I bring patience, clinical focus, communication skills, and respect for accurate testing and ethical care. I understand that audiologists help patients and families manage hearing loss, tinnitus, balance concerns, and communication challenges with professionalism and compassion. I am prepared to support hearing evaluations, treatment planning, hearing device services, patient education, documentation, and collaboration with healthcare teams. I would appreciate the opportunity to contribute to your organization with responsibility, empathy, and a strong commitment to patient outcomes. Thank you for your time and consideration. Sincerely. Elevator pitch: I am interested in audiologist roles because I want to help people improve hearing, communication, and quality of life. I am patient, detail-oriented, and comfortable with both healthcare and technology. I would bring clinical professionalism, compassion, and clear communication to hearing assessment, treatment, and patient support.